like I said, while you're doing that, call your friends, call everybody, and let's have a wonderful time. Now, when they come early, one is able to, because it's not open to everybody, so you have to be admitted. So it takes time to admit people. So when people come early, we can admit people easily and concentrate on the session. So who goes first?
Okay, let me
Yeah.
go first, Aaron.
All right.
All right, my name is Yemisi Shodipo, and I work with Ogun State Broadcasting Corporation, OGBC, here in Ogun State, Abeokuta, the state capital. Yeah, I am into health production and other production, radio production. So it's good to be here. Thank you.
Who's next?
Can we all hear me?
Yes, we can.
My name is Edache Claypolo. I am a journalist, freelance, basically. I run a company known as Biospheros Creative Communications, and it would not hurt to have this information. Thank you. I'm based in
Very
Abuja, by the way.
beautiful. Beautiful. Who else? Next person, just unmute yourself and greet us. My friend from Zambia, my friend from Ghana, you want to say hello to us?
Okay, hello everyone. My name is Eunice Ajiman Ahmed. I'm based in Kumasi, Ghana, and I'm a clinician and then a researcher. I'm mostly interested in sickle cell disease care. Thank you.
Beautiful. And she'll be starting a youth program that will sound like Flavor in Ghana very soon. All right, who else? Who else wants to say hello to us?
Hello, everyone. My name is Tello from Zambia. Pediatrician, but also working with sickle cell disease patients.
Beautiful. Okay. And hope we know that 25th is World Malaria Day, and that's why we are trying to also do this now. Those who know Kleverest Center have been working on sickle cell, malaria. We've done HIV, polio, and all those ones in the past. But our focus this period has been more on HIV and malaria. And Camille did a lot of work around COVID. She's doing work on resistance to some kind of drugs and all that.
And antimicrobial resistance.
Thank you very much. You go tell us all those ones later. Who else is introducing himself?
Hello, good morning. My name is Fauzia Salakosoni. I'm a broadcast journalist. I'm in Lagos. I work with Federal Radio Corporation of Nigeria, Bond FM, a language-based radio station. We broadcast in Yoruba language, Hausa, and Igbo languages. So I'm like a contract staff with Bond FM. Thank you, and I'm happy to be here today to gather more knowledge to equip me as to become a health journalist. Thank you so much for having this conversation. Good morning to everyone.
Beautiful. Bond FM is one of the leading stations in Lagos. Anybody else before we start want to say hello to us?
Good morning again. Yes, my name is Samson. Samson is station manager, Flow FM in Umuahia, Abia State.
And we call him Egweke. Okay, who else?
Good morning.
Hi, good morning. We can hear you.
My name is Lilian Okazi. I am a broadcast journalist with Trust Television in Abuja.
Nice to meet you.
Same here. Same here.
Good morning, everyone.
Good morning.
My name is Michael Oni. It's Enyimba FM in Aba, Abia State.
Don't I know you, Michael? We know each other, right?
Yeah.
Ah,
Good morning.
hi.
So good to be here, and glad to
Good to see you here.
My Oga, I greet you, sir.
I greet you too. The Eimba people.
Yes, sir.
Eimba
Yes, sir.
stands for what do you call it? Elephant, right?
Elephant. Yes, sir.
Mhm. Okay, who else? We'll be starting in 2 minutes. In 2 minutes. Well, this session will be recorded, but we'll make this recording available to everybody. Next time, they will know that they have to attend. We'll be making all the ones we've been doing available to people, and this is the most important one, and they are not here.
I believe there are some introductions in the chat, in the message box.
Yes. And maybe I should nominate someone to read it for us. Who wants to volunteer? Michael, you don't even hear your voice. So. Read some of those
Yes, sir.
introductions for us.
Okay. Promise is joining from Plus TV. I am here to learn. And Promise Ukeje. My last engagement with the Mixed 88.7 FM Uyo as a reporter and news editor ended last December. I'm presently working on getting back to the media, radio, TV anytime soon. Many thanks for this opportunity to learn. I think that's the two I can capture from my end.
Okay. All right. I think that's all that's there. Okay.
Okay.
That's fine. Okay, Ada is there. Yeah. Michael, read another one. You know why I
Yes,
want to hear
sir.
your voice, ba? Michael used to be one of the biggest presenters on Flow FM in those days before
Yes,
he
sir.
now stepped up. He's now Oga.
I'm still a boy. So,
Yeah, story.
Adama Ontieka, I hope I didn't murder your name, says I am a radio broadcaster in Pakpando FM, Oka.
Okay. All right. So I think we can go on and start. Camille, should we start?
Yes. I think we should start so that this tension will just die down.
see who's talking about. Anyway, we read a little bit about Camille on the flyers and the invite, but I'll say a couple of things that's not there. Camille is one of the only Nigerian, and I think about only 3 journalists worldwide that were featured in IJNet's global conference in 2020. Yes. For those of us who know IJNet, International Journalist Network, and that's about the largest gathering of journalists in the world. And Camille was featured there, as the only Nigerian, and I think there were only 3 featured there. Then I think the next year, she was on Internews Network panel on investigative journalism as with regards to health reporting. And then she's won loads of fellowships here and there, latest being the Media EIS Fellowship. Thank God I was there in person to see it myself. But Camille was also the presenter of, let me say, the only station that has a health program that runs Monday to Friday in Nigeria for 1 hour, and that's Darling FM. Camille was the presenter of the health program there called Darling Clinic, and that's a groundbreaking program, and that's one platform she used very well. And then she's gone ahead to do some other things that are really unconventional. She's the coordinator of Art for Health, where she will tell us about it in her own way, where they use art to promote health issues. She coordinates other journalists, supports other journalists like she is doing right now. So some emojis and super claps for our presenter today, our trainer today, Rosecamille Aneke, the certified Camille. That's how you follow her online, certified Camille. She's also an entertainment guru. That's one of the things you need to know. She had one of the most exciting music programs in the East then when she was on radio. So she's a freelance journalist. She supports everybody, so she could consult for you. So after this session, you can hook her up. So over to you, superstar Rosecamille Aneke.
That's actually tough to follow up on because Mr. Arrow have hyped me a lot, but I'm really grateful for that introduction. Good morning, everyone. I've been introduced, but I like to say it again. My name is Rosecamille Aneke. I am a freelance health journalist, and I don't like to. There are so many tags over the years. I've changed my mentality on all of these many titles, and I like to describe myself as someone who loves to tell health stories because I have experienced people in hard to reach communities lose their loved ones because they could not access healthcare, and that was devastating, and that prompted me to continue to tell health stories in innovative ways. I've constantly tried to rebrand and understand that there are better ways and more interesting ways to communicate health. When you mention health, that's actually why this meeting isn't full, because sometimes when you mention health, people think it's boring. But I think I have to start sharing my screen now, and so I can present. But yes, that is me. Let me find this. So like Mr. Arrow said, I have done a lot of work around health. And trust me, when I started presenting, when I started as a health presenter, it was tough. Like I did not know how to do it, what to do. Okay, fine, I'm struggling. That's why I'm rambling. I'm struggling with getting like zooming this. Who can help me? Okay, cool. Here. I just shared it. So yeah, I'm trying to share my screen. Let me get that sorted out. Just give me a few minutes. We're good to go. Can you hear me now? Can you also let me know if you can see my screen now? You can see my screen now, right?
Yeah.
Yes. Thank you very much. Yes. So I sort of changed the topic to breaking into health journalism because I feel that it's a lot better that way, because the things that we do already puts us on the path to actually become a health journalist. And with the COVID-19 pandemic, we learned that we should all be health journalists. And I found that really interesting because at that point, we had a lot of people who struggled with communicating health information. It was a lot of new information, so people could not understand what was going on. Some of them could not properly inform their audience. And it was at that point that several people around the world, including the ICFJ, knew that they needed to train journalists, and they started to train journalists who were on other beats on how to cover, COVID. And some of them, I am one of them, and several other journalists started to cover the health beat, and that was what got them hooked. And today I'm here to ensure that if you're not on the health beat already, or if you're not covering health, in fact, you don't even need to be on the health beat to cover health information or share health information. So today I'm here to convince you that you should do more of that in your programs, right? And the objectives for the session today: introduce journalists and media practitioners to health journalism if they've not already heard of it, and their role in shaping public awareness, to identify core skills needed to become an effective health journalist, and to provide resources that open up opportunities for growth in health journalism. And one thing that I would like to say at this point is that I became successful because I was able to spot opportunities that helped me grow, opportunities that helped me put my skills out there, and opportunities that helped me tell better stories. And I'll be sharing some platforms with you before the end of the webinar today. So what really is health journalism? Is there anyone in the audience who would like to try? Maybe you can type in the chat box. If anyone wants to try, just okay, so let me rephrase the question. When you hear health journalism, what comes to your mind first? Oh my God, my boss is here. Good morning, Mr. John.
Good morning, Camille.
The boss of all bosses.
I'm so proud of you. I'm so proud that you're doing this. I think the biggest thank you goes to Aro for ensuring that as we are gradually fading to the background, we are not retiring, but fading to the background, that those of you we have had the opportunity to impact in one way or the other are taking over the baton, and you guys are doing well. I'm particularly proud of you.
Thank you so much, sir.
Now, to the question you asked, basically, health journalism is the art of telling stories as it regards to health-related matters. It's a specialized field, but I am also happy that over the years, thanks to the innovative nature of, or let me say the dynamic nature of journalism, reporters who have reported other beats have also been given the opportunity to understand the depth and wealth of health reportage. For those of you who have become core health reporters, I mean, you guys have taken it to another level, because now you can in-depthly report, and not just report. Now, this is the part that is most significant for me, and it should be for everyone taking part in this conversation today. The fact that it is about educating and impacting Nigerians. There are a lot of things that Nigerians before now did not know, and there were a lot of things Nigerians thought they knew with regards to their health. But because of the innovative research that continually takes place within the health sector and wellness environment, more information is coming out, and we are now beginning to discover that some of the things we thought we knew were not necessarily correct, and turned out to be even more harmful than the things we didn't know. And that is as a result of health journalism, health reportage, or health reporting at different levels. Our health infrastructure has also improved over time because of the constant reporting of developments within the health sector, where the government will want to take credit. But the truth about it is that the credit goes to the health reporters, because they are the ones that report the true scenarios, human angle stories, as it relates to the state of health of the average Nigerian, especially at the grassroots. And when I mean the grassroots, I'm talking about the interlands. One or two of the most reported or celebrated stories, go and check, whether it is on the BBC, DW, name them, are reports that have to do with health-related coverage in the interlands of sub-Saharan Africa. And my joy is that Nigerians, like Aro highlighted, Camille here is one of few very few journalists who have dedicated themselves to health coverage and health reportage across Nigeria. So I want to celebrate all the health reporters that are taking part in this conversation, and I want to believe that at the end of the day, we ourselves who do not cover health as our core beat will begin to incorporate health reportage and health reporting in our daily reports, because with the current state of the country, the sector or the aspect of living that is most likely to suffer as a result of poor purchasing power is health. Why? Rather than go to the hospital to do proper diagnostics of any ailment, most people will resort to go taking the cheaper route, which is going to pharmacies, and let me say this, unlicensed pharmacies for that matter, to buy drugs, all in a bid to keep body and soul together. So it's not, this conversation is not one that we should pass with a wave of the hand, but we should listen to and engage critically because of the implications and the importance. Thank you very much.
Thank you so much, Mr. Nkamiang John. He was one of the best bosses that I worked under at Darling FM. And when we started this health programming there, he was very supportive with resources and trainers. I would also at this point say that for those who don't know, Mr. Arrow trained me as well. And yeah, it was tough. Imagine like going to cover health when you've never done it before and they tell you have to produce and co-present a health program for 5 days a week. It's a lot of it. It was quite challenging. So don't be scared if this is your first time and you're confused on where to start, what to do. Can I even do this? Wouldn't it be complicated? I'm testament to the fact that you can actually do it. So thank you so much, Mr. John, for that definition. You're absolutely right. Health is important. It's critical as well, because when your audience is sick, what do you tell stories to? Who do you write for? That's a story. That's a question we should ask ourselves. When your audience is sick, when your audience is unhealthy, when you have an unhealthy community and an unhealthy country, things start to be different and it starts to affect your work and your income. So health journalism is an integral part of journalism. It focuses on behavior change at the individual level. It pushes people to make healthier life choices, such as proper hand hygiene. That's something as simple as washing your hands under running water with soap, vaccinating children against preventable diseases, eating more nutritious foods. But it also goes beyond that to address health systems, policy concerns, and also focuses on encouraging the government and private healthcare providers to ensure that health services get to all citizens, regardless of who they are, where they are from, their social status, their gender, and also encourage government to take effective action, not just governments, individuals as well, to take effective action to contain and prevent epidemic. If you remember, we have had our own fair share of outbreaks in Nigeria. I would highlight that later. But yeah, that's really what health journalism is. It includes stories like these, stories around cholera, water, stories around policy changes, stories that after production there's an evidence change. There was a story that was done by Hannah Ojo, and in that story she exposed the high level of contaminants found in the sachet water somewhere in Lagos, and prompted the government to take action against non-compliant water factories. She did a lot of research. She did a deep investigation into this, and after that was done, government actually took action. They raided several water factories to collect samples for independent lab tests. And on October 20th, the Lagos state government revoked licenses of those who did not meet that standard. And that's an example of a health story that have driven change. And that leads us to the why. It is one of the whys. Why? I know you people like this meme. I like to keep presentations like interesting, because sometimes when you're like some of these webinars, you just get so bored. I get bored sometimes, and I don't want to bore people as well. So that's why I try to use these memes. And interestingly, I divert. Interestingly, you can communicate health information with memes. People relate with memes easily, which is why you see the likes of Aproko Doctor using the method that he uses to communicate health information, because he understands his audience. We're going to get to audience, but yes, we're looking at the why. Why do this? Why is this important? So this is important because health journalism serves a crucial role in the society by keeping you and I informed, and the people who listen to us informed about our health and the health of our communities. So we are able to know when people around us are coming down with an infectious disease, and learn what to do to protect ourselves and our family members. It also helps to influence behavior change. If your communication is not influencing behavior change in one way or the other, then you should just turn down your mic, turn it off. Don't even raise the fader if you're on radio. Don't even write the story if you're on print, because the main purpose of that should be to influence behavior change, and that should reflect in the process that you take in putting together the piece that you put out, in putting together the content that you give to the audience. So when you communicate accurate and timely health information to your audience, you help influence their behavior. And when you also simplify the science for your audience, you're helping make a change. Another why is that you can help hold the authorities, government, and healthcare providers accountable as the watchdogs of the healthcare system. You, as a journalist already, you're the watchdog of the society, but now you're being given a higher responsibility, which means that you have to now care about what is going on in the health sector, because it's everything. Like, an unhealthy person can't do anything, and there are several things that come into play into that. There's public health, and then there are several other aspects. But when you're unhealthy, you can barely work effectively. It affects your it affects your income, it affects the people around you, it starts to affect the entire community. Before you know it's the entire state, the country, and sometimes the continents, like we've seen with the pandemic. So another important why is because it helps us manage and prevent outbreaks better, right? So since 2014, we've had like major outbreaks in Nigeria. This data is from NCDC. It's from 2020, so it doesn't include the recent ones. So in 2014, we had the Ebola outbreak. In 2016, we had the polio reemergence. In 2017, we had the CSM outbreak. In 2017, monkeypox. 2018, Lassa fever. 2020, we had COVID-19, and we've gone on to have several other outbreaks. Lassa fever is almost recurring, and it usually happens towards the end of the year because of the dry season and several other things. And we recently had the cholera outbreak, and we saw what happened with the cholera outbreak in Lagos in 2024 and a few other states that it affected. So the why you should do this is to help prevent this from happening, and to also fight it when it happens, right? Preventing it means you're communicating the kind of information that people need that before it happens, and while it's happening, you're also communicating things that people can do to prevent it from further spreading to other people. There are certain skills that you need to become a health journalist, or to cover like health in your bid. So if you're already covering a bit, and it will be a little bit difficult for you to get a spot for health, what you can do is have a segment that could highlight health information. So you could package a 5-minute segment, and you fuse it around what you do, so that people don't even know they are consuming health information, but they are actually consuming health information. These are for people who are already covering like other bits if you're on radio or TV. During the COVID-19 pandemic, Sound City TV and a few others, there were music channels. They were their format was just music, entertainment, but they started sharing COVID information. They started sharing pieces about, oh, hey, here's what you can do in a hyped, fun way. But people are vibing to the music and people are consuming that piece of health information. So if you're working at a station where it's impossible for you to have that health beat, but you have a bit that you cover already, you can slide in these pieces of health information and nobody's going to say, no, don't do it. I know it depends on how you package that piece of health information. I don't know if I'm able to do that on the webinar today because that's in depth. Like it would mean doing an entire webinar on creating health content. Someone's mic is on. Oh yeah. So yeah, some core skills that you need if you want to finally focus on health journalism, like as a specialty: research and evidence-based reporting. A lot of people do take this for granted. I'm not going to throw shades here in the webinar, but I remember after the Art for Health exhibition we held in November 2024, it was on antimicrobial resistance. We were trying to create awareness. After that event, several stories were published, and these stories were published by journalists who were also there at the event. And to my surprise, some of the things that were reported, I said, I did not say it. And then I just kept staring at it like, who was this? Was this me? I was so furious that at the point someone said that antimicrobial resistance was some sort of, I can't remember how he described it. And I just, he said he found the information online. And I kept saying, there is no way you search this and this is the information it gives you. But that really is the issue. How well are you researching the terms? How well are you gathering information on what you're sharing? So these people shared information that did not represent exactly what I said. And it made me really sad, but also encouraged me to plan something for them. I haven't finalized it, but plan something for them to maybe train them further, because you can't keep complaining that people are not getting better or that they're doing the wrong things when maybe they just did not have the appropriate training that they needed at that point to be able to deliver. But yeah, that was a gap that I identified after that program. And it's why research and evidence-based reporting is important. We'll get deeper into it, but research is absolutely key. Understanding public health is important. I'd covered health for 5 years and then I realized that, oh my goodness, public health is very important. I'd covered like several health topics, but the way I would cover those topics now, after being trained by by AFENET, NCDC, and Breakthrough Action Nigeria, which was a program by Johns Hopkins, but the moment it's closed. Their program has finished in Nigeria. But yeah, that made me realize that there's a lot we do not know as journalists, and public health is one of it. It's quite simple. I'll explain later. Identifying health topics is one other thing that you need to have in your bag as a health journalist. You need to know how to identify these health topics and how to approach them. Fact checking and verifying health information. We saw what happened with COVID, still happening now. Audience segmentation. You have to know your audience. Knowledge of the right experts. I know this might sound like, oh, this is not a big deal, but I will tell you why it's a big deal to know who an expert is and who you should actually invite to your program. Now let's move to research. So research is key in health journalism. For you to be a health journalist, you need to learn how to do proper research, and it's not the one where you just copy and paste stuff. It's where you check multiple sources. And even these days, AI has made things a little bit easier for a lot of people. If you're not tapping into that, I think you should. So I've shared, there are a few links that I shared here. These links are sites and sources that you can always go to some of them here you can identify health topics, but from some of them you can do in-depth research on whatever topic you're going to write about, whatever topic you're going to discuss. So the health journalism platform, they have a lot of courses and resources that can help you when you're doing a research. IJNet, ICFJ. So when you click on IJNet, it will show you ICFJ. ICFJ has a lot of resources that can help you when you're doing research. The CDC is perfect. And then NCDC also has, they have a, yeah, they have a feature where you can take courses as well on NCDC. So you're able to get more information, more data on what you're covering. They have data on cholera. In fact, all the outbreaks that have happened in Nigeria, NCDC has the data there. So when you go there, you'll be able to access that data. And another key skill that you need to possess is being able to read the data, reading and understanding the data, because health sometimes involves a lot of data. And if you don't know how to interpret that data, you might be causing yourself and your audience a huge problem. Because if you misinterpret the data, then you're misinforming the people. And then we'll move to the next one. Understanding public health. I said this is very important. As a health journalist, one key knowledge you need to acquire is on public health. There's a quote that I found really interesting. I learned about this quote during my Media EAS fellowship. It's by C. Everett Koop. Healthcare is vital to all of us some of the time, but public health is vital to all of us all the time. And this is because public health is the science and art of preventing diseases, prolonging life, and promoting health and efficiency through organized community efforts. And we are all part of a community. We're all part of communities. We all have families. And it's also the science and the art. So you might just look at it, you're like, oh my goodness, it's just about science. But it's also the art, because you need to understand how people think, how to influence their behavior. So it's a lot of things that will go on in the background to understand how to manage an outbreak, how to control an outbreak, how to prevent one from happening. Prevention is really the base for public health. If you're able to prevent something from happening, then you don't have to treat people from suffering from that thing. If we're able to prevent antimicrobial AMR, that's antimicrobial resistance, then we wouldn't have people going to the hospitals and taking certain medications on certain medication to treat themselves, and they wouldn't abuse it, because that abuse leads to resistance. And that's why I said public health is very important. It's literally the foundation of health everywhere in the world. So as someone who wants to really go into journalism, health journalism, you need to understand public health. There are resources I will share. I'll share some links, and they will include things that you can read up on later if you want to, further your knowledge, which I think you should do, because this class is not enough. This class is not. We did a 1-year fellowship, and for 3 months, each 3 months was on public health and epidemiology, and 1 month was just understanding public health and everything that you should do. So you should know that. And that 1 year was also not even enough. They were telling us it was not enough. So that tells you that it's quite broad, but you can start from somewhere. This is from a resource that you will need later. So I clipped it from there. Understanding public health. Journalists who have a particular interest in public health should take a look at this. Okay, I think I'll pause a bit to see if there are questions, so I don't ramble and go through all of this and not take any questions in between. questions, contributions, whatever, hit me up in the chat or open up the mic and ask a question. Don't be shy. Don't be scared.
Any questions, contributions from anybody? Let's feel free to speak. Aha.
Yes, I have a question. Thank you. Precious Ukeje is my name. So I'd like to ask, yes, there are authentic sources where we could search, for information while doing research. However, when it comes to data in Africa, Nigeria, there is also some sort of distrust and mistrust, about data emanating from this part of the world. How then do we deal with such a situation where we have to, you have to cite a source that you are not exactly sure that people are, people consider trustworthy. And now part of the reasons I asked this question, this just occurred to me, is that in 2021, I was part of a team that was conducting a research for the US CDC in Anambra State then. And it was on vaccine hesitancy. And we realized that people, especially within the rural communities, did not trust the government. As a matter of fact, they even trusted the priests in their church more, to uptake the COVID-19 vaccine and all of those things. So if you turn back and you mention, for instance, data from the government on COVID-19, chances are that the people listening to you may not exactly, agree with such data. So how do you deal with that when gathering data for your program or your reports on health issues? Thank you.
Thank you so much, Precious. That is a very important question, and I like it. Do you trust the data? Precious?
Yes.
You trust it, right?
I trust the data because
Because you know it's true, right?
yes, I do.
But the issue here is trust in terms of your audience, the people that you're going to. How do you build trust with them? How do you convince them that the data you know already that the data you have is true? It's authentic because it's from the right sources. You're getting it from NCDC. You've spoken with experts who are there, and they've given you this piece of data. There was something you said at the beginning that made me wonder, but I like that you eventually narrowed it down. You said data from Africa is untrusted. I was wondering if it's untrusted by the global, the global community, but I understand now it's by our people. So building trust is an entirely different topic, especially if you're communicating health, right? Because I say this because trust is actually the foundation for any relationship, and it's the key thing to do with your audience, because when they trust you, they can ask questions, it can facilitate meaningful behavior change. So for you to communicate the data you have and convince them, you have to make them trust you. So it is you now who needs to build that trust. If you build that trust, then the people who are listening to you or are reading your article believe that what you're writing or what you're saying is true because you've built and established trust with them. And to build trust, like for someone to have trust in what you're doing, means that you have to be credible, you have to be reliable, you have to have some self-orientation. They have to know your why, and that why is a very important thing. I'm going to play a video from Simon Sinek. Maybe I'll play it towards the end. So it is you who has to build that trust. It is you who would have to identify the people that the community members trust. And identifying those people, you can communicate the information you want to communicate with the people, because you know that there's a secondary influence. That the secondary influence is the priest, like you mentioned, whom the people trust. So the priest can influence the behavior of several other people who are under him or who listen to him, and you utilize the priest, and which was the right thing to do. So in building trust, there's an ABCD trust model. I think maybe I would share the resource on building trust, which is different from what I'm doing, from what I'm handling today. The ABCD trust model it means that in trust, you have to be able, you have to be believable, you have to be connected, you have to be dependable. So let's say you're on radio and there are people who are listening to you from a particular community, and they are complaining to you that their roads are their place is flooded, and you're just there in the station, you're just okay, you're taking that piece of information to build a stronger level of trust with these people. You go there, they see you, maybe not you, maybe your station, members of some of your staff who go there, they speak with these people, you go back on radio, they hear what is happening, they know that you care, they know that you're reliable. So you can't just show up one day and not show up for them the other day. You can't just, say one thing and do the other thing. You cannot tell people to wear face masks on radio, but they see you stepping out of the station, you're not putting on a face mask. It's two completely different things. So for you to build trust, like I mentioned earlier, you have to be credible. There has to be some level of credibility. I'm trying to move this. Okay, yeah. So there has to be some level of credibility, reliability. Intimacy is that thing you develop when you are able to, it's not that kind of intimacy, but intimacy is what you develop when you're having communication with people. You're looking into their eyes, they know that you're listening to them. They know that, oh yes, you came here when we had this kind of issue. They need to know that the things that you're preaching, that you have not been paid for it. So they need to know that you're transparent, that one government official haven't given you $1,000 to preach this information. So once they know that you don't have anything to gain from pushing this piece of information, it helps to build a level of trust. So when you've done all these things and you bring that piece of data and you're giving that piece of data to your audience, they believe you. There'll be some people, it won't be all of them, and that's where audience segmentation comes in. There'll be some people in your audience who believe, there'll be others who would not believe. That's okay. It starts from somewhere, right? But you have to have that trust model. I think that when radio stations go off air, that they are breeding the trust between them and their listeners, because they tune in today, you're off air. Before it starts to win, they even start to doubt you. Are these people even serious? So these are the little pieces of things that could influence trust. And the moment you've built that trust as a person, as a broadcast journalist, as a print journalist, as a media practitioner, then it will be easier for you to spread this piece of information. Why do you think that people believe a lot of things from Arise TV? Because they've built a level of trust with the people. People saw them show up during the NSAS protests. They saw them, they connected with them, and they know that these people care about them. So most of the information that the presenters would share, they would trust it. One more question. Precious, do you have a favorite broadcaster, TV, radio?
Well, I used to follow Charles Anyagolo and Ngozi Alebu very closely at some point. So,
and did you believe most of the things that they said?
yes, I do. I wanted to say, but I still do. Because
Why?
for someone like Charles, when he asks his questions, I see I see that he has done his homework well. There is a depth of knowledge in the questions that he asks. So that does not just come from, top of the head. You know that somebody has done their homework properly. The person has gone through credible sources. And then by the time you listen to the interviewee, especially I listen to their interview programs. By the time you listen to their interviewees, how they respond to the questions, you will know that this is exactly the right question to ask, and that this right question came from a place of thoroughly built knowledge from the right sources.
Thank you so much, Precious. Yes, perfect answer. And that's actually the answer to the question you asked me. I've explained it, but you see the things that you've said as an individual, that is also how your listeners or the other people who consume your content online would feel about you. That is how they connect with you. Does that make sense?
Yes, it does. It does. Thank you so much.
Thank you. All right. I really appreciate that question. You just I like the conversation on trust, because it's very, very important. It's in all relation. If I don't trust Mr. Ara, I won't even be here. I wouldn't be here. So there are several things that we do as individuals, and but trust is a foundation for whatever relationship you're building with anybody, your business partners, your family. Your trust is what would make, anyway, a child does not have an option. When your father throws you up, the child believes he's looking down at the father, knows that the father will catch him or her, or that the mother will catch him or her. That's eye contact, yeah, that this person cares about me, they will not let me fall. Okay, so we'll move on to finding health topics. So there are key health areas that can help you find topics if you're aiming to be a health journalist. I know some of us are already health journalists, and sometimes it's difficult to find topics. I know this because there are people who sometimes reach out to me to say, oh, they don't even know what to discuss anymore. They feel they've run out of topics and stuff like that. So what I've done here is highlight a few key health areas that you can now dissect and have conversations around each of them for even 3 months, 6 months. You take maternal and child health. You cannot discuss maternal and child health in a day. Can't even discuss it you can't discuss it in a week, because there are several things that happen within that area. There are so many angles to covering maternal and child health. There are so many story angles. If you're looking at producing stories, there's the mother aspect, there's the environment aspect, there's the access to healthcare aspects, there's the funding aspects, there's the affordability of healthcare. So there's a lot of things that are in play when it comes to this. So maternal and child health can serve you for 6 months or 3 months. You just take it and break it into bits. So maybe you just wonder, what does it even mean? Another day you can look at the data around it. Another day you can look at how do we prevent what really happens? How do we prevent this from happening? Who are the people that have experienced this? How are they feeling? There's the mental health aspects to it. So when you pick each key health area, you're able to now break them down and then discuss those subtopics that have come out of them. Vaccine preventable diseases. So you can't even, if you start, it's plenty. There are so many vaccine preventable diseases, and for each of them that you take, each vaccine preventable disease, let's say you take diphtheria, you cannot even just discuss it in one day. You can do an entire story. You can travel to areas that have constantly had diphtheria. Why is that happening? Why is this still happening? Why do we have diphtheria outbreak in some parts of the north, but we don't have diphtheria outbreaks in some parts of the east? You can do a state-by-state comparison, which becomes an entirely different story angle. You can look at the communities that have have suffered from diphtheria, and diphtheria is absolutely vaccine preventable. It's like if the children are vaccinated against this, they will not suffer from diphtheria. They will not spread it to other children and spread it to other people, and that's which is how an outbreak happens. Then you have the non-communicable diseases. There are so many. That's where sickle cell disease falls under. And then under sickle cell disease, it is not even a topic that you can finish once. You can do an entire. Mr. R is a Mr. R is an evidence to that. You can do an entire year just having sickle cell disease conversations. Cancers, diabetes, cardiovascular diseases, all under non-communicable diseases. And when you're approaching each of them, you can take them from the human angles, because those are the human angle stories or solution-based angle are really good. Like I think that they help convince people more than when you're just saying, oh, this is this is that, this is this that. But then when you tell it from a human perspective, there's somebody who have been through this, or there's somebody who has had an experience, people are able to relate to the story, and they have it in the back of their mind that, oh, this is what can happen. This is how I can protect myself. It makes them ask more questions. Are there other things that I need to know? Am I genetically predisposed to this? What do I need to do now? Like you just make them ask questions from the way that you design the programming. Then antimicrobial resistance, which is a growing global concern, and it's also being an issue that I have, not just me, but the media EIS frontliners. We are 29 in number, and we were trained for 1 year by NCDC, AFINET, and Breakthrough Action. And we realized that antimicrobial resistance is an issue that affects all of us, and that is not very well spoken about. So there are bits of information around it, but some people might be hearing it for the first time. And when some people hear it, they're like, wait, what's that? What does it even mean? This threatens to gain global, oh my goodness. Like when you look at the data, you will be shocked. But I don't want to mention the data. Today. However, I'd like you to know that the things that we do every day can predispose us to developing resistance to certain things. So let me just break it down. Antimicrobial resistance is when fungi, viruses, parasites evolve and are no longer responding to medicines that are meant to, they are meant to respond to. And when this happens, it makes infections more difficult to treat. It means that there's a risk of disease spread, and the person who has it might suffer severe symptoms. For instance, someone who has been treating UTI is even, when we say UTI, it looks like it cannot happen to us. Let's even take malaria. When some people, you hear people that, oh, they've been treating typhoid and malaria. Typhoid and malaria, I also need to say at this point that before you just say you have typhoid, you have to make sure that you've done the proper test. You can't just go there, they'll take your blood, and then all of a sudden they tell you have typhoid. No, you need to do a proper test to ensure that, because that is one driver of antimicrobial resistance. People go and then they start taking antibiotics, and they're treating something that is not what they're suffering from. And because they are consuming that drug, the bacteria starts to become resistant, because they know that, well, there's nothing really happening. So let me develop resistance. So when the real drug comes, or when the real sickness, when I now make this person sick and they take that particular medicine that they usually take, nothing will happen to the bacteria. They're stronger than ever, and you will just keep being sick. There are several other drivers of AMR, which includes not keeping to the prescription. So you've been told to take these antibiotic morning, afternoon, night, and you take it morning, afternoon, and you don't take it at night. You take it the next day, you forget it, because you're just not the kind of person who pays attention. When you do that, you're encouraging antimicrobial resistance. You will not go to hospital and they'll tell you, oh, you're suffering from AMR. So it's not a thing that you suffer per se the same way you will suffer malaria, but it's a thing that happens when that typhoid that you've been trying to treat is not going again. The medicines that usually you used to treat it is not working for it again. It's a thing that happens when that fungal infection isn't disappearing, even though you've used the particular drugs, the particular medicines that have been prescribed for you over and over, but it's not going, you're not getting better. And when this happens, it means that if you infect another person, what they get is that resistant one. It happens in we have drug resistant tuberculosis. There are several of them, but because I'm passionate, I could go on and on about antimicrobial resistance. So back to what we are discussing. Then we have climate and environmental health. Climate change is a big deal now. There are several conversation topics around it. Then mental health. You cannot function effectively if your mental health is suffering. The same way you cannot function effectively when your physical health is suffering. So mental health is a very important conversation to be had, and you can have an entire conversation on mental health for 1 year. On Darling Clinic, then we dedicated our Mondays to mental health conversations. So we took like different topics under it, from even something as minor as how to deal with a heartbreak. How to deal with heartbreaks. Something as simple as what to do when you lose your job, because all these things affect us. So we tend to have these conversations in such a way that we're helping people build resilience, and resilience is one thing that you need to have a healthy mental health. There are several other things, but let me not go deeper into it. But point is, there are several topics on the mental health, communicable diseases. There are several things that you can discuss there, from tuberculosis, HIV, cholera, COVID-19, like we know. Then zoonotic diseases. Zoonotic diseases are diseases that are caused by animals. We spend a lot of times with animals. We eat them. Some people have them as pets. Most of the outbreaks that we've suffered, their origin is from, most of them are from animal. Lassa fever, rodent, Ebola, brucellosis. And this brucellosis, I've heard recently from a veterinary doctor that sometimes the symptom is similar with malaria. So when people go to hospital and they actually have this brucellosis, they don't know that this is what they are suffering from, because they are not running that test for them as a human. Animals usually do have it. So they will not test you for this. They are testing you for malaria. They are treating you for malaria, and you're still getting sick. So I think that if you're on the health beats, please pay attention to this. Have conversations around it. How can we make sure that people are also humans are also tested for this when they go to the hospital? Wait, I need to be sure that's brucellosis. Yeah. That people are testing for this when they go to the hospital, are tested for this when they go to the hospital, and they are complaining of malaria that they've been treating, or typhoid that they've been treating that isn't going anywhere. And the other key ways to find topics is using health days, like the World Malaria Day that is upcoming on the 25th of April. There's a site where you can find all the health days. So when you find all the health days, you plan ahead. You plan your topics around it. You plan your conversations around the theme. You plan ways to maybe produce public PSAs or clips that you can use, or personal stories that you can use to tell, to highlight the importance of the celebration of that day, of the commemoration, I beg your pardon, of that day. So this year, the theme is Malaria Ends With Us. Reinvest, reimagine, reignite. And your job now, before this, before we hit 25th of April, is to take a look around this theme. How can I simplify it? How can I tie it to what is happening around malaria? All of us suffer from malaria. It's like a Nigerian it's like a Nigerian national anthem when it comes to health. Anytime you see someone, they're like, oh, it's malaria or malaria or malaria. But there are people who have eradicated malaria. There are places where they've been eliminated as well. So why can't we, head towards that? What are the things that we can do? What are the things that the individuals can do in their homes? Are these mosquitoes becoming resistant to the insecticides? I don't know if anyone have noticed it. There was a time if you use some insecticide, it just be as if you spread perfume on the mosquitoes. Has anyone noticed that? Like, they are just, some of them will just still be flying around and you're wondering what's going on. So these are like several conversations that we can have. You can look at it from the solution perspective. Where are we on the malaria vaccine? How do we have access to it in Nigeria? How do we get access to it? What are the innovative things happening around malaria? So you can also cover the people who are doing things to fight malaria. So solutions perspective. Health is not just always about the problem. It could be fun. There are solution angles to it. I like the fun part. Yes, health is health, but there are ways that we can communicate it to not make it too, oh my goodness, like what? And you can find health topics from trends. So when you check on social media, you can find keywords that people are using. So they are with the cholera outbreak. If you checked Twitter at that point, you would see that there was a time people were saying, oh, one of my friends drank something, and they've not been fed, they've been vomiting, or they've been, stooling for so and so. Somebody say, I've been having stomach. So during that period, when you hear those kind of things, it's an indicator that something might be happening. And as someone who is interested in health journalism or a health journalist, that should be your, okay, what is going on? And can I tell NCDC that something like this is happening, because I've seen that more than 10 people have told me about this in my community. So health journalists can also help public experts identify whether there's an outbreak in a certain community, or if there's something that is happening in a certain community, and they can either identify the sources. They can start to work on how to control it early before it becomes becomes blown up. Then from articles that people have written, you can look at an article and you say, okay, I can pick 1 or 2 topics or 3 topics from what this person have written. And then studies that people have shared. There are researchers, doctors, epidemiologists, scientists who are constantly publishing their studies. So when you look at their studies, you can also pick some topics and discuss them. Fact checking. During the COVID-19 pandemic, the word infodemic became popular. It wasn't so popular. It doesn't mean that misinformation did not exist before. Infodemic, the word, became popular because, oh my goodness, people are overloaded with information. Whether it's the right information or the false information, people were just overloaded, and because of that, it was beginning to affect a lot of people. They didn't know what to do. Some people were overdoing. So fact checking is an integral part of health journalism. In fact, you can't do health journalism if you're not fact checking, because you will just see you just see something on X and somebody says, research shows that 25% of men with bald head are safe from COVID, and you're like, hey, this is news, and then you just broadcast it. Did you fact check? Did you check how many people were on the study? Did you check if they were peer reviewed? There are so many things that you need to look into before you share a piece of information. You fact check data that people are sharing with you, the statistics. If people have compared, if people have said 90% of people in Enugu wash their hands, as opposed to 20% of people in Kano, you have to fact check that. Or somebody says, oh, this is happening in Enugu right now, or this is happening in Abuja right now, people are la 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 la. You have to fact check to be sure that it's the right information. And when you're fact checking is an entire topic on its own that we cannot finish here. I just wanted to introduce you to it. Who created that piece of information? What is their intention? So when you see something forwarded as received, forwarded many times, sometimes put yourself, become the person who wrote the information. Ask yourself, like, what was this person intending to achieve? Ask those questions. Does this make you angry? Does this piece of information you've seen, does it make you angry? If it does, pause and take a proper look at it. And check on other sources. What are other credible sources saying about this? So you see this bit of information. What is Punch newspaper saying? What is Vanguard saying? What has the NCDC said? What have other credible sources said about this before you share with the people? It's important to share timely information, but it's much more important to share accurate information. So do not be in a hurry to say this has happened, blah blah blah, when you haven't confirmed what is going on. Right? Even if you have to share it, you be careful the way you share it so that you don't misinform people or cause panic. And then we move to audience segmentation. Audience is very important. They are the people who are trying to change their behavior. And by the way, I would also recommend taking a look at social behavior change communication if you're going into health journalism. I'm sharing this because the way we've been taught is different from what I know now. Like the things that we learned previously and the way that we just like practice these things is a lot different. If you understand social behavior change communication, then the way you produce your health program, the way you write an article on that, a health article, will be different from the way you used to, because now you know what you want to achieve. You know what you want your reader to know at the end of reading it. You know what you want them to start to think about. You know what you want them to start to do at the end. If you don't know these things before you start to craft, before you even write, today we are discussing this, let me say, what do I say now? Safe water. Let's say we're talking about water. Say safe water. You need to know what you want to achieve. So, and for you to be able to do that, you need to understand your audience. Crafting the right message for the right audience at the right time through the right channel is key. You cannot craft the right message for the wrong audience and expect to achieve results. It won't work. For instance, you're selling, what would I say? You're selling private jet, and you target me as one of the people, as one of the people to get this bit of information or advertising. You're targeting the wrong. It's the right information, but you're targeting the wrong person. It's not for me. You should know where your audience is. So when you know who your audience is, you craft the right message for that right audience at the right time. Who is your audience? Where are they at this point? What are they doing at this point? You cannot be broadcasting a message for your audience when your audience at that point, you know, your audience isn't listening. Maybe it's the time when they are at work, like very busy at work, and they don't have radio at work. Maybe your audience only listen at night. There are people who listen to radio at night. There are people who listen when they're on their way to work. So you need to know these things, and then the right channel. Where are they? Are they on TikTok? Are they on X? Are they on Instagram, YouTube? Are they in the rural communities that they don't have access to the internet? So knowing your audience, crafting the right message for them at the right time through the right channel is key. And for you to know your audience, you have to do something called audience segmentation. This means dividing your intended audience into groups based on their demography, their age, their gender, marital status, geographical location. Are they in the urban, rural, semi-urban areas? And then also, importantly, what are look at the behavioral aspects, the psychographic aspects. What are their fears and concerns? What are their hopes and aspirations? And that's why social behavior change is important. The social behavior change communication teaches you all these things. And there's an entire format on audience segmentation, like where you can actually dig deeper into this and understand your audience. So there's nothing like general public as your audience. There are people who say, well, who is your audience? The public. It's too broad. So you have to have a primary audience, and the primary audience is comprised of the group of people that are most affected by the health problem and whose behaviors you want to change. So you've identified a health problem. You know that these audience are the people who are most likely affected or most likely to be affected by this health problem. So you've identified them. They're the primary audience, and then you target a message to them. And then to a lesser audience, a secondary audience is the group of people who wait. Okay, primary audience are the people who are most affected by the health problem, and they are the ones whose behaviors you want to change. Then the secondary audience is the group of people who are also affected by the health problem, perhaps to a lesser extent, and who have an influence on the behavior of the primary audience by reinforcing or facilitating changes. And this is where what Precious mentioned comes into play. There's a priest, he's not the primary audience, he's the secondary audience. He's also affected by the problem because the people around him are affected by the problem, but he's not directly affected. However, this priest has an influence on the behavior of the primary audience. So you can craft a message targeted at that secondary audience so that you can influence your primary audience. It's also what NCDC did during the COVID-19 pandemic. There was information that the people who were mostly affected by this were the elderly, people who were immunocompromised, who's immune. Like there are people that were mentioned that were more at risk. So what then happened when people saw those criteria and categories of people who were more at risk? What did they start to do? People were partying. Young people said, it's none of my business, like they were doing things. Then they had to change their messaging to target that secondary audience so they can protect the primary audience. So the messaging changed to protect yourself, to protect your loved ones, that you can get COVID and it might not hurt you the way it will hurt your parents. So you can go out and party and you get COVID and you recover. But you go back home, you infect your parents with COVID and they get it, they suffer and they die. So when that message hit them, you found out that people were now thinking not just about themselves, but also about the people at home that they most likely could infect. So that's why audience segmentation, knowing your primary audience, secondary audience is important. And finally, going to knowing the experts. So not every doctor is an expert. You're having a conversation on, let's say, what do I use now? What do I use? HPV. Okay, so let's say you're having a conversation on a HPV vaccination, and then you just bring a doctor. I'm not saying the doctor will not have the knowledge, or the doctor might have the knowledge, but is that person the right expert for that topic at that time? Because you want to run away from misinforming people. I remember someone sharing that a doctor was on radio saying something and he was misinforming people. So he had to call in. He's also a doctor. He had to call in because so now that doctor, I think he was a family physician or so, but the person who was in was a veterinary doctor, and had more information, probably more qualified to speak on that topic at that time. But they invited another doctor who is also a doctor, an expert, but not qualified to speak on that topic at that time. And he was misinforming people, and he had to call into the radio show because it was too much for him. So knowing who to invite when you're discussing issues around gynecology, there's a gynecologist. Knowing who to speak to when you're discussing vaccine. There are people in the primary healthcare development agencies that know all about vaccines and how they work. Knowing that if you want to have a conversation on antimicrobial resistance, that you can also invite an epidemiologist, or you can also invite a public health officer, a public health official. They are able to explain how that works. Or knowing that also having a conversation on AMR when it comes to animals, that you can invite a veterinary doctor, use them I don't know if any one of you have ever had a conversation with veterinarians. Oh my goodness, you're missing a lot of information that you can be sharing with your audience if you're not interacting with them and you're not involving them. I did not know this until I went for a meeting, and we had people who were crafting something around antimicrobial resistance that was earlier this year, and we had a lot of veterinary doctors and people from the Ministry of Agriculture, Ministry of Environment, because environment, plants, animals, human, all come together when it comes to AMR. It's a one health thing. So you can't be having that kind of conversation and exclude those other people. They have to be a part of the conversation. So don't just invite anyone because they're a doctor. Invite other people as well. There are nurses who might know certain things. There are also people, let's say you're discussing something around hair lice or dandruff or something. Do you know that if you invite someone at the salon who does this, they might have more knowledge than when you invite a medical doctor per se? So knowing the right expert, asking them the right questions. Don't go and ask the hairstylist the question you're supposed to ask the doctor, and ask the doctor the question you're supposed to ask the hairstylist. And that's it really. I think oh, I'm so glad I utilized the time properly. So yeah, here are resources that you can, these are resources that are used to prepare for this, and these are also places where you can find opportunities. Fellowship opportunities exist for health journalists. One of the key moments of my career was getting the ICFJ Global Health Nutrition Reporting Fellowship. It had a grant of $3,000, and it was a good moment for me, being able to tell the stories that I did tell in collaboration with 3 other journalists. So with that opportunity, I was able to network with the story. It was a collaborative story. We did audio, print, and then we did I think photo as well, because the other lady was a photojournalist from Tunisia, and then we had Ambrose, was it Ambrose also from ICIR, and they did in Kano, and then I went to Ebony. So the 3 of us told one story, the same topic, the same story, from different places. So collaborative journalism is a thing. You can collaborate with your colleagues who are in other states. You've identified that there's a cholera outbreak in your state, and there's also a cholera outbreak in another state. You can find out how they are managing it in that state, and just help the authorities make better decisions. People can learn from others. States can learn from others and implement what other states have done that worked for them. So collaboration is important. Don't see it as competition. It's health. It's not that competitive. It's competitive a little bit, but it's not that competitive. Just collaborate with your fellow journalists. Tell these stories, and let's impact lives. Thank you. I'm done. Thank you. Questions, comments?
Wow. Thank you, Camille. So it's time for questions, comments, addition, subtraction, multiplication, whatever we can do. But first of all, if you know you enjoyed this session, if you know you've gained something from this session, please send those emojis right now. Fire the emojis. Fire the emojis. Aha. Very good. Very good. So this recording will be made available. Camille, are you making your slides available?
I don't know about that, but I would make the links. I'll share them now so people can just click. And also I wanted to share Media EAS Fellowship. I know that the first cohort is done, so keep an eye out in case they make an announcement for the second cohort. It has never happened anywhere in Africa. It's the first one, and other countries in Africa are trying to emulate that and see if they can replicate in their countries. So try to participate in the second one if they make an announcement. I will share links here now.
Okay, beautiful. Because why I asked that question is that always several people who got the links have sent me message my WhatsApp. Can I get the presentation? Can I get the presentation? I've been doing this thing now for so many years. They don't even read the presentation because by the time I listen to the programs, I don't see anything there. It's always very important to attend trainings physically. If it's online, you are still physically there. You get to listen. You get to hear the. Now check out the stories Camille shared. You're not going to find that in the presentation. That's what really makes it to make sense. Even when you're doing your program, it's not just reeling out the health jargons and all that. It's just like she said, it's stories that go around it. That's what makes it to make impact. Okay, so but the recording will be available to some key set of people. So if you know you want the recording, send an email. The email has been posted there to casecenter@googlemail.com, and it will be made available to you. And Kleverest Center certificate should be given to everybody that attended this class. And for those of you who are media people in Nigeria, you know the breast it's let me just stop there. Just stop. But we'll ask you questions. You must do something. You know me, I'm very wicked. Okay, so questions for Camille. Questions for Camille and any other addition that anybody wants to add. Please let's say something. And Michael Oni, I want you to tell us how you think health issues can be mainstreamed into all those your political programs that you do from morning till night, every day of the week. Your own is to talk about Tinubu and governors. So I want to hear, how can we make health issues not to be segmented to one corner and bring it, just put it across. Like Camille is doing something wonderful with her art for health, concept, mixing art and health together. There are so many ways we've done things around sport and all that, but how can we make it to occupy that space that your prime time in stations that you give to only the politicians who tell us all kinds of funny things every time, rather than using it to show them things like this that they should be focusing on. I liked Michael to say something about that. Samson Eze, you too, but very briefly. So questions, anybody? And I think Camille, you want to play a video for us, right?
Yes. I want to play a video, and I want everyone to watch this and pay attention and find your why, because that might be what has been holding you back.
So maybe we should take the video now while you think of your questions and comments. Links are there on the chat, so you could pick up those resources from there. All right. So video time, movie time, Silverbird Galleria, Genesis Cinema.
We assume even we know why we do what we do. But then how do you explain when things don't go as we assume? Or better, how do you explain when others are able to achieve things that seem to defy all of the assumptions? For example, why is Apple so innovative? Year after year after year after year, they're more innovative than all their competition. And yet they're just a computer company. They're just like everyone else. They have the same access to the same talent, the same agencies, the same consultants, the same media. Then why is it that they seem to have something different? Why is it that Martin Luther King led the civil rights movement? He wasn't the only man who suffered in a pre-civil rights America, and he certainly wasn't the only great orator of the day. Why him? And why is it that the Wright brothers were able to figure out controlled powered manned flight when there were certainly other teams who were better qualified, better funded, and they didn't achieve powered manned flight, and the Wright brothers beat them to it? There's something else at play here. About 3.5 years ago, I made a discovery. And this discovery profoundly changed my view on how I thought the world worked, and it even profoundly changed the way in which I operate in it. As it turns out, there's a pattern. As it turns out, all the great and inspiring leaders and organizations in the world, whether it's Apple or Martin Luther King or the Wright brothers, they all think, act, and communicate the exact same way.
There can be a ton of reasons for not having any work experience. Maybe you just graduated. Maybe you never entered the workforce because you got married, you had children.
And it's the complete opposite to everyone else. All I did was codify it. And it's probably the world's simplest idea. I call it the golden circle. Why, how, what? This little idea explains why some organizations and some leaders are able to inspire where others aren't. Let me define the terms really quickly. Every single person, every single organization on the planet knows what they do, 100%. Some know how they do it, whether you call it your differentiating value proposition or your proprietary process or your USP. But very, very few people or organizations know why they do what they do. And by why, I don't mean to make a profit. That's a result. It's always a result. By why, I mean what's your purpose? What's your cause? What's your belief? Why does your organization exist? Well, as a result, the way we think, the way we act, the way we communicate is from the outside in. It's obvious. We go from the clearest thing to the fuzziest thing. But the inspired leaders and the inspired organizations, regardless of their size, regardless of their industry, all think, act, and communicate from the inside out. Let me give you an example. I use Apple because they're easy to understand and everybody gets it. If Apple were like everyone else, a marketing message from them might sound like this. We make great computers. They're beautifully designed, simple to use, and user-friendly. Want to buy one? Meh. And that's how most of us communicate. That's how most marketing is done, that's how most sales is done, and that's how most of us communicate interpersonally. We say what we do, we say how we're different or how we're better, and we expect some sort of behavior, a purchase, a vote, something like that. Here's our new law firm. We have the best lawyers with the biggest clients. We have, we always perform for our clients, do business with us. Here's our new car. It gets great gas mileage. It has, leather seats. Buy our car. But it's uninspiring. Here's how Apple actually communicates. Everything we do, we believe in challenging the status quo. We believe in thinking differently. The way we challenge the status quo is by making our products beautifully designed, simple to use, and user-friendly. We just happen to make great computers. Want to buy one? Totally different, right? You ready to buy a computer from me? All I did was reverse the order of the information. People don't buy what you do, people buy why you do it. People don't buy what you do, they buy why you do it. This explains why every single person in this room is perfectly comfortable buying a computer from Apple. But we're also perfectly comfortable buying an MP3 player from Apple, or a phone from Apple, or a DVR from Apple. But as I said before, Apple's just a computer company. There's nothing that distinguishes them structurally from any of their competitors. Their competitors are all equally qualified to make all of these products. In fact, they tried. A few years ago, Gateway came out with flat screen TVs. They're eminently qualified to make flat screen TVs. They've been making flat screen monitors for years. Nobody bought one. Dell came out with MP3 players and PDAs. And they make great quality products, and they can make perfectly well-designed products. And nobody bought one. In fact, talking about it now, we can't even imagine buying an MP3 player from Dell. Why would you buy an MP3 player from a computer company? But we do it every day.
And that's where I want to stop it. So I shared the link here in the comments. It's in the resources, in the list of resources, so you can just watch the full video. It's 18 minutes long. You can get the full idea of what the message is trying to pass. But the most important thing I want to take away, and I want you to take away, is the why. Why do you do it? Why do you go to your station every day? I know a lot of people will say money. Yeah, they want to earn salary. In our country, we just want to eat and survive. But yeah, you have to find the deeper why, and that why is your purpose. And if you don't know your why should your audience care? Why should the people who are listening to you care? They need to know your why, and your why is why they would listen to you and believe the data and the information you share. Thank you so much.
Very much. Truth is, health, if it's because of money you're doing health programs on air, when an issue gets into your family, you understand the importance of knowing the reason why. So questions, comments, anybody?
I think Lillian at some point had their
Yes,
hand.
Lillian. Fire.
Good morning or good afternoon. Thank you so much. I'm actually new to health. I just got assigned to cover health for my office a month ago.
Yay, congrats.
Yes, it's been very tasking. I'm really struggling, I wouldn't lie. In fact, there's some points I felt like going back to tell them that I'm not doing a game. You people should take it. So yeah, okay. So I am working on a health program on Trust TV. It's called Healthy Living. I used to produce it, and I'm now being asked to present it. And I realized that it's been a lot easier behind the scene. But the major challenge I face is getting the government agencies to respond appropriately as at when due. Even after you've written official emails and letters and, reached out to them through the official channel, they do not respond promptly as at when you need them. World Immunization Day is coming up. I've been trying to get across to primary health care. They've given me a positive response, but not just what I want. They are not giving me people that would work with me or give me, the kind of information I need. I'll be honest, working with NCDC has been challenging as well. I just go to their website to get the details I want. But if you want to get someone from there to join in on the show, so as to build the trust you're talking about, Nigerians want to see that the people that are in these agencies are speaking as well. Working with NHIS has also been a very great struggle. I would really call out these agencies because I have been trying to reach out to them. You send letters, they put you through so much tasking, the bureaucracy is a lot, and you produce your program, it looks haphazard, it looks incomplete, it doesn't look balanced because you don't have the side of the government to talk to you and give you, not just, I don't need the numbers on papers, it's TV, people are seeing, even radio or podcast. It was easy when I was doing podcasts because I would really beg and beg and beg for hours to just talk to me on the phone for 2 minutes. Let me just get a yes, this is the number, or no, this is the number. But when it comes to TV, the bureaucracy is so much. So at this point, what can we do to make sure that if I'm going to be giving statistics and numbers, NSCDC is saying that, Lassa fever is increasing in A, B, and C states, and I need them to come into my studio, or let me come and meet them. Even if you're in a hole, I will take my camera and come to you. Let's talk about it. Let's analyze it. Let's look at it critically. Let's get the numbers while I also get a health professional to key in on it. It doesn't work that way. So at what point, how do you create that balance? Do you just ignore them and go ahead with sticking to just giving out health information when you know that health reporting is way more than just giving out health information?
Oh my goodness. I can feel your frustration, Lillian, from we all face that same issue. We all face that same issue. And it was one of the reasons they created that Media EIS fellowship. And that's because they were trying to, the Breakthrough Action, they were trying to also make NCDC, like government and authorities, understand that the media is not your enemy. These journalists are not fighting you. They just need this information at this time. And they like to break the news, break the stories. So it's a work in progress, but it's a big struggle. That's what I can say. I can, from my end, share some contacts that I already have that I know are able to respond. However, things changed a little. We have a new government, and the DG NCDC have changed as well. So some of the people that used to be there under communication, I don't think they're there anymore. But I'll find out if.
No, they're not. They've changed. I've been mailing them. They've changed. Yes, they're all different now.
Dr. Disu and the rest, they are no longer there. So
no, they are not.
Yeah, but one thing I learned is that for every time you invite them to a program, they also have to notify their superiors. And if they don't get if they don't get a go ahead from their superiors, they cannot come to that program. They cannot respond. And that's the main bottleneck. And there's nothing they can do. There's nothing you can do. The only thing that can happen is the superiors will not have to understand that they need to let them go at certain points. And it began to happen during COVID. The NCDC began to respond. If you invite them, they will come. If you call them, they'll respond on radio, because at that point they understood that this communication is important. Also, sometimes when let's say there's an outbreak and they're still gathering numbers, like the pieces of data, they've not finalized, they cannot give you, like that kind of information is not something you say about, so they are still compiling and they're still getting from some states and stuff like that. So that also makes it take a while for you to get what you need. But I know as journalists, we always want it now. But there's a process that this thing takes. I don't know if I have the content here, but there's a process that this thing takes, from people who are sent to the field, from them monitoring and gathering and identifying the primary source, to doing contact tracing. And there's a lot that happens behind the scene. I would never make an excuse for the government, but I would like to also tell you as it is that this is what happens when there's an outbreak. There's a process that things take. Sometimes when they delay too much in sharing information, even if they don't know, they cause people to panic. What they are learning now, I don't know if they've learned it or not, is that even if you don't have the full information, you can still tell us, we are still gathering. That is also information. So, my dear, I really don't know what to tell you, but I would say that if you have the data, share the data. If you have an epidemiologist that you can invite that does not work like under NCDC, like an epidemiologist or someone in public health that know what they are doing, you can also invite them to help you analyze the data. I think that's also one thing that you can do. And from your end, also preach to people prevention, what they can do to stay safe, and tell them government isn't responding. We haven't gotten feedback from this. You can also say that you haven't gotten feedback at the moment. And that's it. You're being genuine. Sometimes you don't have to have everything on your decks, for you to share, information with the people. I think that's what I can say. I don't know if anyone wants to add to that, maybe Mr. Aru or some of my other bosses, and share how they've handled these kind of situations in the past.
Okay. But let me say that soon we'll be having another session in a couple of days or weeks, and we'll be looking at creative program production. So we'll look at creative ways in which you could get things done when you're doing this kind of programs. But remember, Camille talked about stories. The one challenge journalists have is that when it comes to experts, guests, and all that, the first thing at the top of our head is government officials. Let them be the last. Honestly, see, you need to start doing programs in such a way that these government officials will be looking for you, not you looking for them. Okay? That's what you need. You need to work toward. And you need to follow human angle stories. Just follow people's stories. You see Christina Mampo, even when she's talking about the Gulf War, whatever kind of crisis she's talking about, she just follows somebody's story. And by the time you put that story, you find that those government officials will be running after you. I always share the story about the erosion story I did in Nekedo erosion site. Put it on the BBC platform. That was in 2008. No government officials, nothing. We're just following people's story, and everybody was saying, hey, yeah. And within a couple of weeks, the government came and they fixed that road. People living there today don't know that once upon a time, there was a gully there that divided that road into two. So that's one thing you should focus on. Focus on people's story. Like now, we are talking about malaria. World Malaria Day is coming up. All we'll see is for the past couple of years, I've been, so see me later. And I'll arrange guests for you for World Malaria Day, the so-called government officials that you need. But that's what we focus on most of the time. But what about people going through those malaria issues. What about the communities where these things happen? Camille talked about research and data. There's a lot of data about how malaria, is transmitted online. We have two researchers here currently with Liverpool University of Tropical Medicine, one from Zambia, one from Ghana. They are working on a lot of research. They are researchers. On our sickle cell project, we are linking researchers with broadcasters. So you can get information that you could use, verified information that you could use. So there are areas, communities you could go to and just check what's happening there. How is the environment? Do they live what's it called, water open, and things like that, and just talk about those kind of stories. And I'm telling you the truth, those government officials will chase you, they will run, and they will want to look for you. So let's work towards that going forward. Because government officials will frustrate you. But
True.
do these human angle stories, and Camille was talking about $3,000 now, beans. So if you want to get fellowships, government official stories get fellowship unless you are exposing something extraordinary. But a good human angle story will get you a wonderful international fellowship. What got me my first job in international organization was doing HIV report using the stadium, and that was during the All Africa Games in 2003. You get it. So look for all those other creative ways of doing your content. We have Precious, your question. You've been talking since morning. So Precious, make sure you brief them. BB, our superstar BB, that also has a wonderful journalist. You have something to say?
Yes, thank you, sir. It's going to be very brief. So I honestly celebrate every journalist who is doing their, what they can to ensure that they put the correct information out there. So my question is, a number of times, the government lives in denial. For instance, the first time cases of COVID-19 was reported in Akwa Ibom State, the government, their first reaction was to deny that situation. A lot of other things have happened that way. You have the accurate information, you have put that out, but the people who are supposed to, in some way, affirm this information are trying to save face. So they are not coming to say, oh, that's true. And then in some way it begins to, yes, you are sure of what you have done, but then so it possibly makes people begin to think, what the journalist reported, is it true or not? And I mean, a lot of examples are coming to my head now, but what do we do when it comes to doing our job, especially with regards to health reporting and government denial of the accurate information? That's the question. Thank you.
I feel like we should have a part 2 to this webinar, and there are people that I would love to. Maybe I'll speak with Mr. Arrow later, and would invite those people, because those are people that need to hear the kind of questions that are coming up from this. What I would say is that governments can deny, like in Kogi, there was people knew, like at the point that we're even telling some people not to enter. They're even telling the rapid response team maybe not to come, to don't do anything, that we don't have COVID here. But I'm sure some of them have noticed that there were COVID cases. So those are problematic states. Like you mentioned Akwa Ibom, there were other states like that. But what can you do at that point as a journalist? You have this information. You need people to stay safe. So at that point, just focus on preventive measures. What can people do to protect themselves? It's as simple as that. Because whether government denies it from today till tomorrow, people will still be falling sick. And they know, the people who are listening to you know that some of them are falling sick. But you, as someone who has information, know what they can do to protect themselves. Just keep giving them that information. That's all you can do. Do you understand? Like, that's all you can do, except you want to do a proper investigative journalism piece where you will now go inside and find those stories and then expose the government that the government is lying. Then that's different. Yes, you can go ahead and do that investigative story. It could win you an award. But if you're not doing that kind of story, just focus on what the people can do to stay safe. Simple. Bring yes, we know it is not here. It is not here. But this just that's all I can say, really. Bring your experts, talk about stuff. You're not announcing numbers or anything. After all, people don't even pay attention to numbers. If you even call numbers, they'll tell you that you're lying. They'll tell you that I did not see Shebi they were playing football in so and so. Like, people will say a lot of things. So just use the stories around you. Use your own personal experiences, use the facts that you have online, bring people from other states. How are they managing their own? So you can also go to a neighboring state or interview someone from a neighboring state where they confirm these cases close enough that they have a boundary with your state, which means that if they have a boundary with your state, there's a possibility that this infectious disease can come into our state. Speak with those people. Do you understand? They have it, they confirm. What are they doing to stay safe? Be using those people to share your information. It's as simple as that. Thank you.
Thank you. Thank you.
Abiodun?
Okay, thank you very much. Yes.
Hi.
Good afternoon, everyone. Good afternoon, our tutor today. I really appreciate what you've taught us, and I'm really glad I'm here. To Lillian, I just have few things to say. I really concur and agree with Aru on starting our stories from human angle. Yes. But then, do we still have operational meetings at our various broadcast stations? Because when we hold operational meetings, we do have the opportunity to bring forward our 13 weeks billing. Some of us are not able to write out all the 13 weeks billing, but we can have 6, we can have 7, which helps us to identify the topics or the things ahead of us. Like we talked about the 25th of April, we know it's coming, we know it's a UN day. So we've got to prepare ahead. Do we still attend programs, events where we are called to attend? And then when you get to those events, do you interview people or just take those pitches at the event? When you get to an event, because you already have your billings behind, your mind, you're able to do what I call more interviews, using those people at the event, those people you are looking for. They are the event. Asking some of the questions you need to ask ahead of your program. You can use your camera to pick them even there and then go back to your station and creatively use the material you have done in your program. For example, being a TV person and you want to talk about Malaria Day, and you find somebody at an event to talk about Malaria Day, you can take that to your station and make the expert now react to what this expert has said, because the expert needs letters or what have you, bureaucracy, and is not able to come to your program. But you have already interviewed him when he is free and not knowing that he will appear on your station on a particular day. So lastly, I want to say that we must also learn to leverage on friends. Arrow, we know that I know how to call him out when I need to be in Bayelsa, when I need to be in Umahia. It happens that I need to travel, I need contact of colleagues. You call out, you ask people, you share, information, because if you don't give, nobody gives you. But when also you need to share. You need to be able to share yourself, share what you have, and then people respond. So leverage on friends, contacts, collaborate with people so that when you are stopped, you'll be shocked that the person you're looking for is a friend's brother, is a friend's relation. And then your work is done, you know. And I said lastly before, but there's also this aspect of trying to write letters ahead. For my station, I work with Voice of Nigeria. I tell my colleagues, you need to do an interview at so place. You have 4 5 weeks to write to that organization to send reminders, and then they become embarrassed themselves. And then who is signing your letter? Is signing your letter? Are you signing it by yourself? Of course, not many will answer you. But when they see the Director General's signature, or they see the Director of Programs signature, they will immediately hasten up and answer to. Thank you very much once again. Thank you, Aro, for sending this invite to me. Yes, thank you.
Wow, that's super great. Camille, you want to add something before Ochola,
Oh
you
no,
come up?
that was perfect. It was too good. I wanted to say when Abiodun was mentioning leveraging on friends, there are several groups where we have health journalists. There are several health journalist groups, so you can be a part of it. What people usually do is when they are looking for certain guests to be in their program, they just type an SOS or say, like, oh, journalism help. There's also a hashtag too on X. I don't know if it works in Nigeria, journalism help or something like that. And you say who you're looking for your program, and they're able to reach out if they have the contact. When I did a story in Lagos, the way I got the contact of the commissioner and the people I needed to speak with was a fellow journalist, who worked in Lagos. So yeah. So health groups, maybe Lillian, if you're not a part of them, maybe I don't know, maybe drop a message to Arrow, and he sends your number. I'll add you to a particular group so you can get the guests that you need. That's it.
Claypool, Ochole.
Thank you so much, sir. So I just have a little contribution. Having listened to everyone who has spoken so far, it's important to remind us that we belong to a professional, we're doing professional activities, whether you're reporting for, the health sector or for any other thing, we need to, first of all, remember that we deal with information. And how we send out that information is very, very critical. I say this because usually in cases where there are things like pandemics, or even when you're pursuing general human interest, reporting, it's important to remember that government usually has guidelines for information dissemination, especially around things like pandemics. Even when you have verifiable information, you need to be very careful with how you release it. Sometimes it's important for us to check and double check, with the government first before we pass on this information. Thank you very much.
Thank you for that comment. So it depends on the kind of information, really. There are information you don't have to double check with the government. But what you said is very important. I'm glad you highlighted that. We didn't really look at the ethical part of of reporting health, the things that you should do, sensitivity, all those things. We didn't cover it today. I think we should have subsequent conversations around this. It's not something you can learn in a day. Maybe when we look at if we're able to look at the ethical aspects of reporting health as well, maybe that comes into play, Claypool. Yes, you cannot just because you heard someone said, you will not go say that there is one confirmed case of, because someone told you and you can say there's one confirmed case of COVID. Meanwhile, they've just collected the sample because they are suspected case. So you also need to know the difference between some of those terms. We didn't even look at terminologies. So before you can say a suspected case and you say it's a confirmed case, and you report it, you put yourself in trouble, because you've reported wrongly. So thank you so much, Claypole. I don't know if there's any other thing or any other question, but I've thoroughly enjoyed this. There's a lot more to be shared. If we want to continue this conversation, maybe in future when we have time, we can do we'll do a series and also got more ways to spread health information. I'm personally stepping away from doing documentaries every time. I'm trying other formats because my audience have changed. I'm freelance at the moment, so my audience have changed. My audience is online, so how do I reach them? So I have to try out other formats as well. And that's also what you should be thinking. What are the innovative ways? How can you communicate health differently from the way others are? How do you make it not boring? I convene this event, Art for Health Niger, Art for Health, where we use art to communicate health information and advocate for health. It's interesting. Artists come, they exhibit their work around the theme that we've chosen for the year, and we do a lot more with games, like creative games and drama. So these are things that you can use also in your program. You sometimes you just don't have to sit there with the guests. If the government isn't coming, go and act a drama. You have your data, act drama, put your data in that drama. You get? So let me shut up. I think it's too long, 2 hours. Oh my goodness. Let me just shut up.
Okay. Now that's the thing. Now Camille went to the FM, right, in Port Harcourt, and she trained them on how to do health programs, and she told them how to use mind mapping. And within 5 minutes, there were just about 13 listeners in that hall, and within 5 minutes they came up with over 300 topics, health topics. Camille, am I just blowing your trumpet anyhow again? Did this happen?
Yes. This happens. Mind mapping works like magic. It's the easiest way to find topics for for your program and plan ahead. You can have 100, 200 topics. So for the year, you're sorted out, and you can now record, find your guests ahead of time, look for where your guests attend events like Abiodun mentioned, interview them ahead of time. And then when there are days, health days, you already know by the beginning of the year that this health day is coming on 25th. So you plan ahead of it. But that mind mapping it's really miraculous. Even now I still do it, even when it's not about health. What's the first thing that comes to my mind? I ask other people, and then we use it in brainstorming. There was something I was going to say. Some health issues also pop up. They are unplanned for. So let's say you've already planned a topic, and then you hear that there's a cholera outbreak in your state. You cannot stick with what you've planned for that week. You have to address what is happening and tell people how they can stay safe, do PSAs, record PSAs that people can play across belts. But make sure that you're keeping your ears to the ground to hear what is happening so you can plan ahead. NCDC has this thing where they already know the seasons where you have certain outbreaks, Lassa fever, cholera during the rainy season. So you usually know that maybe between March and April and September, there might be cases of cholera. So they prepare ahead. So if you know that, then you also prepare alongside. So before it happens, your program is already on prevention because you don't want it to happen. So you keep hammering it long before that period. So when it starts happening, you know that people already have proper health information. Behavior change does not happen in a day. It doesn't happen in one program. It's a constant thing. So always bear that in mind. Once again, let me shut up.
Okay, I think the last question will take Aisha Ali. Your hand's raised. Is Aisha Ali there? Aisha Ali, your opportunity.
Yes,
to shine.
I'm here. I'm here. Can you hear me?
Yes, we can hear you.
Can
Go
you
on.
hear me?
Yes, we
Okay,
can. Go
I
on.
couldn't unmute myself. It was hard for me to unmute myself. Anyway, my name is Aisha Obali. I work for Nigerian Television Authority. I had other engagements. I'm so sorry I joined this meeting late, but the part I have listened to is very, very apt and very, very insightful. Thank you so much, Madam Chidera. But you were talking about going to train some people in Port Harcourt. Is there in any way, because we need these kind of things, is there any way you are partnering with NTA to see that you train us on how to get topical issues to discuss? Though NTA as an organization, we're always talking about topical issues, but as individuals, we also need to learn these things so that we're able to get how to do future reports, or we call them special reports in the case of television. So I don't know if you're partnering with NTA. That's just what I want to ask you.
Okay, let me answer that one straight up.
Okay.
Personally, as Kleverest Center, not even when I was at BBC Media Action, that one is uncountable. We we can't count the number
Okay.
of trainings. NTA has received loads of trainings. There are so many people that have been so trained in NTA that are actually trainers who can train on this. So what I need you to do, and funny enough, the last training I even did in NTA last year that was shared in the program's news groups, a lot of you guys did not turn up at the headquarters. Only a few people turned up, and it was pre-training for NTA. Now, what I want to say is that I hear these stories always. We have a group. Your people are all in that group. The first group has over 1,000 broadcasters and upcoming academicians, general managers up together. The second group has over 800 and something people. You are a member of that group. How many are
Yes.
here in this training today? You get it. And this is
Okay.
free. So training is very, very expensive. It's very, very expensive. You have to pay a trainer, you have to fly a trainer. So when you see a free opportunity like this
Yes.
and you
We
don't
should
make
leverage
use
on
of
them.
it, it's sad. So what I want you to do, you go now to be the born again preacher to your colleagues, and all of you
Okay.
repent, go back, do some in-house talks amongst yourself, like people mentioned. Most times you don't even have those production meetings, which is a very great learning platform. Then go cry to your management. You have general managers here today in this session. So general managers too, head of programs and all that. You people also know how to arrange training sessions for your people. Now with these online platforms, it's easier. So go and repent first of all. Change your ways, take advantage of any opportunities like this. Ask questions in various groups you belong to, and then cry to your
Okay.
management to do the needful.
Thank,
Okay.
okay.
All right.
Okay. Thank you.
But
Thank you.
thanks for being here. So we've tried a lot, and let me also announce that we are also working with some top level organizations to organize a bigger summit where these orgas of these health organizations would be in, that would help us tackle some of those challenges. Camille might be smiling now, but she can't tell you what the stress you also add, trying to get journalists, trying to get support to do health programs is very difficult. Even your own station will not support you. They will knock health programs to one corner. A couple of years back, I pulled several GMs together on a project, and there was no follow-up by the owners of the project. It was called Lafia Project, funded by DFID, and we're looking at human capital development, trying to get commitment of everybody. Health issues go beyond. It goes into manufacturing, whatever sector you want to think about. Once the human is sick that's supposed to do that job, you can't do the job. If the people in government are sick, we'll have problem. So we need to take this discussion beyond. So all of you here now who spend your Monday to Friday every day talking about Tinubu and Wike and Fubara, you need to start talking about health issues there and hammering it. We need to mainstream it. If not, you keep on crying that, government officials don't want to come. Okay. And then organize events, pay visits. Like, for instance, during the seasonal malaria chemo prevention campaign, I had to do a training on my own for the FCT Public Health Department because they were refusing to attend interviews, like Lillian said. And after that, they started showing up. Even the National Malaria Program, it took over 1 year to get them on air, but one had to do those kind of interventions. So we are organizing that kind of high-level event, but the encouragement to be able to do that event is if those of us who are at this level take these free webinars we do more seriously, start doing content, start doing things, so that we that are trying to reach out to those people at the top and the organizations to support journalists and trained journalists who will have evidence to show to them that, look, these people are committed, they want to do these things, but they need your help. Okay, so any final words from anybody? I want to thank all those who are here. We had Olorunfemi from Global Village in the UK. He has an online platform, online programs that's focusing on health, mainly preventive health. In the UK, they have an organization, it's called Global Village. We'll be sharing some of that in the Kleverest Center group. You want to join the group, just send a WhatsApp to the number there, and we'll put that there. John Nkamiang, he calls himself the boss of bosses, who is the currently head of national head of programs, Rapid Network. Oni from AIMBA, Samson Eze, who is coordinator, as far as I'm concerned, in Abia State, and my friend from Ghana, Evans from Ghana, Muniz from Ghana, and Madam Pauline is here. Madam Pauline Ogbudaga, who's retired from AIT, one of the greatest voices on radio. Then she's here. So
My brother, thank you. Don't mind me. I don't like talking too much, but it's been a wonderful session.
We know, ma. When I was sending this thing out, I have to say this: Madam Pauline has been more consistent in a lot of these webinars, more than those of us that need it the most. She's seen all in broadcasting and retired for so many years. And while sharing this thing, someone from print replied to me and said, because said how to be, it was titled initially how to be a health journalist. And the person said, I should be the one training, not going for training. I have over 2 decades experience. I said, so what? That is even dangerous. We learn every day. There are new things every day. I'm sharing from somewhere here with Liverpool School of Tropical Medicine, and honestly, we have not even started when it comes to health communications. We have not even started. If you know what is on ground, we have not even started. So we learn every day. Thank you, ma. And we have also here Ellen Odele here. John Nkamiang, you made reference to her in your session. She is here right now as one of those that helped our own John Nkamiang to find his way in the media space. She's here with us. She's the retired GM of NTA, Teju Osho. So these are elders. We also have Justin Ama. He's also a health journalist, a general manager. All these are elders. If you want to just drop 15 seconds of words of encouragement to us as we sign off. John also has his hand up. Spinke, you also have your hand up. Okay, 15 seconds. Let's just, as we round up, one after the other.
Okay. First of all, let me say a big thank you to Camille. Again, you've made me proud. And then let me quickly say a big thank you to Madam Helen Odele Omar, as she's fondly called. I don't know if you remember, but you were the instrument to which I started my career in television. I was just that boy who used to carry tapes and follow Shegun Odegba me up and down. and you saw me and you said, today you will do this thing, and I did it. And several years after, I'm still doing it. And unlike my big auntie Pauline, I don't intend to retire anytime soon. This one will take me all the way to the other side. Who knows? Maybe there's communications on the other side, and I'll continue from there. So thank you, everyone. But we must recognize. Thank you, ma'am. We must recognize the importance of this opportunity, and I agree with Aaron Leonard. I think it's time we die down on the scripted political drama that is unfolding in our great nation and begin to x-ray the things that really count. And health, well-being, mental health that has come to the fore in recent times. I think these are things we need to happen and truly, bring some relief to Nigerians and our dear country. Thank you, everyone. God bless you all.
Okay, Bolanle, you want to say something before our other elders speak?
Yes, good afternoon. Thank you so much. I want to appreciate our facilitator for today. And I also want to appeal to all other journalists on the platform that we might face some challenges in the process of doing our job. We should not relent. We should not be perturbed. We should just continue. Like as we mentioned, we could have a private program that will be doing this health reporting on, whereby one, it is well embraced. Even those stakeholders that needed to be approached, that they are not ready to come, they would definitely come and be part of that. So I want to say a very big thank you to Ms. Chidera for this you have done. And Mr. Arrow, thank you so much for all you've been doing all this while. We so much appreciate, and we pray that it continues and God continues to be with each and every one of us. Thank you, and do have a very beautiful afternoon. Thank you so much.
Madam Ellen, you must say something. You must say something.
I knew that long pause was waiting for me. And like Pauline, some of us are very shy, you get. But Aaron, you've come a long way. It's like you got bitten by this special bug, to empower the media space on all areas. And you've just been so consistent, and you've been so helpful over the years. You talked earlier on about how much you did for us in NTA, and whether the staffers, really benefited from it. I liked when you were saying to that young lady that she needed to have a change of heart, to repent, because when they have those freebies, trainings, when you're within a sheltered organization like NTA, you really do not know those free things that come to you, how valuable they are. And maybe not for the immediate, but for much later on in life. There's so many things I've said to myself that if I knew better when I was in NTA, I would grab more of it. So thank you very much, and thank you everyone. John, when you were talking, I was just laughing. You were a young colleague, very focused, and it was a pleasure working with you, and Big Shag and everybody in the sports department. I wasn't in sports, but I was a producer who did almost everything. I could produce and host almost every kind of program, and it was a pleasure working with you. And I'm so happy that you come this far. Thank you, Arrow, and thank you for everyone who made this possible. I'm coming on board for the very first time, and I'm really happy that I joined today. Well done, Arrow.
Thank you very much, ma. We have Madam Claire. Madam Claire, I hope you have something special for World Malaria Day. That's Oga Madam of NTA Good Morning Nigeria. Your hands up. So, Madam Claire, you have the floor.
Oh my God. Arrow, thank you. But first of all, good afternoon, everyone. And I'd like to pay my homage to my madam.
Don't go there. Don't go there. Don't go there.
And I was, in
Hello.
fact, I didn't want to say anything. When I heard your voice, I said, no, I must say something. And also to say thank you. I've not had the opportunity to say thank you. Auntie Helen was my producer back then when we were doing youth scene, when we were in our youth. I know,
Wow.
I know all she made me go through. We slept in our house, we ate, we drove. Thank you. I know one day I should be able to show my appreciation, but please thank you.
You
And
have, you have
yeah,
by rising, by doing so well. You have. That's the only way you can pay us back. When we see you, becoming the best that you ever could be.
thank you, ma. Thank you for all the troubles, and I hope I didn't give you much trouble. Sister Pauline, aha. Thank you too for all the behind the whatever behind the screen support and
Thank you
everybody.
too.
John, thank you, Arrow. Arrow, let me say something. We have editorial meetings every day, both online and in person. And at that editorial meetings, stories are generated, ideas are generated every day and debated. So, when the young lady was asking for training, I'm sure she's not indirectly saying, look, we do not know, when stories break or when they evolve. No, we have everyday editorial meetings to decide which stories to do, how to do it, how to go about it. So, and you also talked about the trainings that you have given, been part of NTA. I mean, I can count the last training we did. You know the number of people that attended. It was a pity. It's a pity, or should I say, it was a pity that a lot of people didn't turn out at the last one you talked about. But NTA staff are hungry to learn, to break the frontiers. So please don't be tired. Don't get tired of us, even when we err. Forgive us. So I use this opportunity to beg. Sorry, no vex. Forgive us. Thank you, everybody. If I didn't call your name, it's just because I came late and I'm seeing lots of names and wonderful people. Please, I pay my respect and homage. Auntie Helen.
Claire.
Yes,
No
ma.
wahala. I love you.
Thanks a lot. I'm really glad you guys made it, and this will be made available. And I'm sure you share with your team, because we really need to change the narrative. Health journalism needs to get in there. And Camille is, I don't know what to say about Camille. Let me say something that even when I'm broke, and I remember that there's a Camille somewhere doing wonderfully well in the world of health journalism, I just feel fulfilled, and I'm sure that's the feeling of Madam Ellen also calling, and you,
Sure.
Madam Claire, John, when you share with people and then they rise and grow like that. That's the only thing you can journalists be paid? Can a trainer be paid?
At all.
You get it, so that's how it goes. Like I always remember Mama P, the first person that gave me, Mama P of NTA, that gave me my first broadcast experience way back in
Oh, Patricia.
1991. Yes,
Mm,
NTA Channel 5 Abuja.
yes.
She was the one that put me on air for the first time. Young guys. you know. And then I was now offered one request program to present, that was done by Hima Adum then. But I was in school, so I was shuttling. Those kind of experience, you never forget the people who give you that opportunity. So when those people see us grow and rise, that's the joy. So if you're here in this training today, the next thing we want to see, what will make Camille happy, is that your program wins an international fellowship. What I've noticed is that it's the same set of health journalists that have been winning all the fellowships every single year. So let someone else from here say, oh, as a result of this training, I've changed my ways, I've changed the way I do programs, and I'm able to apply for an international fellowship and win. Unfortunately for me, I didn't win any international fellowship because I started working in an international organization before I even knew that things like fellowships even existed. And that's why I keep encouraging us. See that kind of money Kalmi talked about. Now she can boldly stand as a freelance journalist, do her own things, do the way she wants to do them, think of new ideas, new opportunities, create new things for herself, and then build people because she's been able to apply herself to this training. I remember the day she called me and said she was scared when Internews sent her invitation to be on an Africa-wide panel. Just by doing one small, you think it's small, program on health. So let's keep the good work going, and boosters to everybody. Evans from Ghana, thanks a lot. Now, I would like you to make arrangement for us to replicate these things in Ghana. So, hola me. and let's do it. As the big brothers Nigeria, we have to carry Ghana along. If not, we won't have support in Africa.
Sure. We will help you with that.
Yeah. All right. So thanks a lot for everybody. So now it's open mic time. Say good wishes and everything to Camille and everybody. Camille, thanks a lot. I know your schedule is very tight. We really, really, really appreciate it. God bless everybody. And remember, we are sending out certificates to everybody that attended this training. So just drop your full name the way you want it on the certificate with your email address, and it will be sent to you alongside this recording. Okay.
Awesome.
Thank
Awesome.
you.
Good afternoon, all.
Yeah.
Okay then. Bye now.
Bye-bye.
Thank you, everyone. Bye.
Nagode, thank you very much. And someone is still joining. You're welcome. And there are links to resources on the chat, so we can copy that. It will also be sent to your email also. And remember the WhatsApp number 09089009000. Save it as Kleverest Center.